Well, eating disorders can either mean overweight, obese, or it can mean hypothalamic amenorrhea, which means underweight and or bulimia or that sort of eating disorder. And it can affect the hypothalamus, which is I call it the primitive region of the brain that actually controls the secretion of GnRH, which actually is what stimulates the pituitary gland to secrete FSH and LH. And so some women with eating disorders have a hypothalamic disturbance, and they're not making FSH, LH, they're not ovulating, they don't even make estrogen. And if they get over their eating disorder, very often their hypothalamus starts to work again, and then they can get pregnant naturally. In any event, whether it's an eating disorder of obesity or an eating disorder of skinniness and hypothalamic amenorrhea, we can always solve that problem with IVF, always. Now, if it's hypothalamic amenorrhea, which is like the skinny patients, so to speak, that aren't making FSH or LH, well, in those cases, we need the Denmark Mini IVF. We need exogenous, obviously. But for other patients, endogenous works fine.